Okay, we're going to now demonstrate doing a heel stick on an infant. The main focus is going to be that you're going to want to be doing the outside of the heels, just this fatty portion of the heel here. It's difficult to show this on this particular baby doll, but this is what we've got to work with. So we're going to first gather our supplies. You're going to have your gloves, your alcohol, a gauze pad, your microtainer tube. There's different types of lancets. All are okay to use that we have in our clinic. It's just a preference. Whichever way you prefer is best. And a heel warmer. I always start with the heel warmer. Put your heel warmer on and leave that in place while you're getting all of your items ready. And make sure that you have somebody who's going to be a good holder for you to be able to restrain this child. So we put our heel warmer on, leave that in place. We've identified the baby. We've clarified our orders, making sure that we have all of the labs that we need, and we know that we have the right patient and the right test that we are performing at this time. Today we are going to be performing a CBC on Sally. So we will introduce ourselves. Hi, my name is Stacy. I'm going to be doing a heel stick on your baby. Most times we will allow gravity to help with this. So sometimes if you can have another person hold the baby up, or have them have where the foot is dangling, can be a little bit easier. You're going to have your alcohol pad. And we're going to wipe the heel off. Do a vigorous scrub on that for at least 15 seconds. We'll let that dry. And then we're going to use whichever one we choose. I like these ones better because they seem to be work a little bit better for me, but these are just as good. It just depends on whichever one you like. Either way is okay. Just make sure you're comfortable with whichever one that you use. So I'm going to use this one. You take the top off and then you hold the baby's foot like this. You're going to push in hard and press. There will be blood coming out, so you're going to wipe off your first couple drops of blood. And then when you can get it into your container, we're going to make sure that we just let it drip in. I know there's no blood dripping in this, but if you can kind of imagine, we've got some blood drops going in here. And then in between each one, just kind of give it a little bit of an agitation so that it's not going to clot for you. Don't scrape. If you scrape along the heel, it's going to cause the blood to break down and you're going to get hemolysis. So make sure you just let it drip in on its own. You're going to want to make sure that you fill it up to the proper line that is on the tube, and then label it correctly. Once you're completed, this baby of this young age, you do not put any band-aids on, so just apply pressure and have the parent hold that until you're done.